Hi, I'm Dr. Christine Anderson. I am a chiropractor who is board certified in pediatrics and pregnancy, and I also hold a certification in childhood developmental disorders, as well as a diploma in homeopathy, and I'm trained in craniosacral therapy, and I have a lot of tools in my office to help children grow up healthy and live an optimal life. So I am coming on tonight to talk about the Moro Reflex in the series I'm doing on primitive reflexes. And I'm going to get into why a retained Moro reflex may cause things like motion sickness, poor coordination, anxiety, vision problems, learning problems, allergies, hypersensitivity, aggression, phobias, social issues, and hyperactivity. Now, this may seem like a mishmash bunch of symptoms, or in some cases, that they're even diagnoses. And you think, well, how can one primitive reflex, if it's retained, cause all of these things? So stay tuned and you are going to find out. First, I want to remind you that I did an introduction to the neurologic reflexes. I'm going to put the link in the description. I highly recommend going back where I talk about all of the reflexes systems and what they mean. And then also going back and looking at the video I did on the overview of primitive reflexes, which is, now I'm going into the individual ones, but to understand why we have these reflexes in the first place and how important they are. So let's dive into the Moro reflex. And this is a perfect picture of phase 1 of the Moro reflex. So typically this reflex is elicited by some sudden change of position or a loud noise or a sudden change of light, even pain, temperature, any type of changes that might threaten a baby or seem like it's a threat, or even rough handling. But this is the first phase where you have the arms go out from the body, the hands are open, and sometimes there's even like a little tremor of the limbs, and we're primarily concerned with the upper body. The lower body can do various things, but typically this is what you see in the upper body. And you can see in this baby, the eyes get kind of big, and they get this sort of look of fear or fright on their face, like, whoa, what is happening? And sometimes they might even cry. The second phase is where the arms come back into the body and come into adduction. Here's my little baby. Now this baby's too happy, so we can't do that thing of fright, but the arms would come out and then come back in. And you can elicit this by dropping the head back and the arms would come out, or you can drop the whole body down and the arm would come out. Let me do that again. And up. So it's easy to see on this little baby. It gets a little bit more difficult to test in older children, but I'm going to go into how to do that. And this is what should happen because this is wired into babies, and it starts quite early on in the development process, 9 to 12 weeks in utero. So this is really, really early on in the first trimester. And this is why, early on you might even feel, or later on as the baby gets bigger, some of those sudden movements of the baby could be this Moro reflex being elicited. So as I said, it's an involuntary response to a threat. It's a survival mechanism. And so this is where the fight or flight system comes in, our sympathetic response to a threat in our environment. It makes us aware, it makes our brain active, it makes us ready to act in some sort of way. Along with this sympathetic response, you also get a release of stress hormones. You get an increase in blood pressure, heart rate, respiration rate, because you are getting ready to fight or flee or sometimes freeze. But this is all wired into us very, very early on in life. Now, the reason this reflex occurs is that it also involves the vestibular system, and I talked about the vestibular system in great detail in the tonic labyrinthine reflex, and I will put that link, so I'm not going to go into much detail, but the vestibular system is wired into the inner ear, so the ears, the hearing, and it's also wired into vision, into the eyes. So this is why you might see some of these effects as we move on into what happens when this reflex is retained. This is also sometimes why babies are having trouble at night or at naps staying asleep, because they wake themselves up with the Moro reflex. And so sometimes this can be hyperactive in a baby. And this is why you will find a lot of parents need to swaddle their babies so that they can get some rest. Let's move on to why the reflex might not be there, or why it might be asymmetric when the baby is first born. So when a baby's first born and you take them to the medical pediatrician, or hopefully you're bringing them to a chiropractic pediatrician, and you're having the reflexes checked, what if the Moro reflex is not there? Or what if it's on one side and not the other? Well, this is what I am looking for when I'm doing a newborn exam. So it might not be there, or maybe asymmetric. If mom, pardon me, if mom had some in utero constraint when she was pregnant. And if you go back to my pregnancy and chiropractic video, I explain way more about this. I'll put the link in the description too. But basically what this is that there's mom's pelvis is not lined up properly. It changes the amount of room for the baby to move around and also to engage in the pelvis in order to be born. That might lead to a difficult birth. It might be prolonged. There might be birth trauma, a stuck shoulder, which is shoulder dystocia. Interventions might end up being used, whether it's forceps or a vacuum or even a C-section, which means that there's problems going on and the baby needs to come out. So what some of these things can end up doing is creating compression of the brainstem, which is part of the brain connecting, it's the lower part of the brain connecting the brain to the spinal cord, and it's right at the foramen magnum at the exit of the skull. And I go into this in detail again in my craniosacral for newborns video, so I'll stick that in here too. And this can be due to some cranial restriction and also upper cervical, which is in the neck, subluxation, so vertebra out of alignment, compressing or creating tension in that brainstem area right at the back of the head. So right there, okay? Now, in extreme cases of trauma, you might see a brachial plexus palsy. And what this is, the brachial plexus, are the bunch of nerves that come off the neck, and they come and cross the shoulder or go out to the arm. So they're all from the cervical nerves, so the neck nerves, starting in the kind of mid to lower part of the neck and going down to even into the upper back. I'm going to show a picture in a second what that looks like. So if you see this in your child, you know that they may have had some trauma to their neck, and this may be one of the reasons why a Moro reflex is not there, or one side and not the other. Clavicle subluxation or fracture. So going back to that shoulder dystocia, if a shoulder gets stuck, sometimes it will actually break in order for the baby to be born. This isn't uncommon. And that is one of the things you may find. Your baby doesn't want to use that arm, or you're trying to move it, it doesn't want to move it, and certainly this reflex would be absent on that side. It might not be fractured, but it might be subluxated, somewhat out of alignment, and therefore that's restricting motion, which is what I can also detect. So let's take a little bit further look at brachial plexus injuries. The first one is Erb's palsy, and it's been called the description is a waiter's tip injury. Back in the day when you were slipping the waiter or the person serving you, a few dollars to seat you at a good table or get you into the restaurant, you would just put your hand behind you, hence this term. So it's antiquated, but nonetheless, it does describe. Now, this baby at the top has it on both sides. This poor little baby definitely had a hard time coming out. But you will see that rotation of the shoulder, and then the hand is flexed and facing towards the back. I have seen Erb's palsy in my office, and it resolved when I reduced the subluxations and the restrictions. Klumpke's palsy is on the bottom. That's a little bit lower down in the neck and presents itself more as the arm is in front, the hand is flexed, and you can see a little bit of like a claw-like hand, so the fingers are bent at the tip, but not at the base of the wrist. So it's an interesting presentation. I actually have never seen a Klumpke's palsy. Usually it's more of an Erb's palsy presentation, at least so far. Who knows? Maybe one day I will see a Klumpke's in person. All right, so what if we have a child who has a retained Moro reflex? So that means when I check their reflex and they are beyond 2 to 4 months, so this integrates really quite early, then it is going to mean that that reflex has not integrated. It hasn't, the brain hasn't gained top-down control to say, you don't have to reflexively move if your head moves back, or if you think you are going to fall when you are dropped. So if it's a baby, then what they're going to do is when I do the reflex, they're going to just keep their arms in. If I, drop them back, they're not going to have them out. They're just going to keep them in, or they may even try to grab for you. But those arms aren't going to come out, or they shouldn't come out past 4 months. In an older child, it can get a little bit more difficult because they might be too heavy to cradle and hold and try to drop back. So there are different ways. One of the ways I test if the child is not too big, again, this is based on size, is I have them stand there, feet together. I tell them to close their eyes and tilt their head back. Remember that head back type of thing? And then I say, when I clap my hands, I want you to just drop back and I'm going to catch you. And so I'd say, make sure you wait till I clap my hands. And that gives two things. It gives them a cue to drop back and lets them know I'm ready. But it also, because of that loud, sudden noise, can stimulate this Moro reflex. So if a child has a retained Moro reflex, they will not be able to just fall back. They're going to take a step back. A lot of them almost do like a back bend. It's pretty incredible. Or they're like, I just can't do it. It creates too much anxiety. And even if they do it, I'm like, how does that feel? Or is your heart pounding? Or, did you have fear doing it? So it might be that they're able to fall back, and that would be a mild retention if they had a lot of like, whoa, the adrenaline got going. The other way I can do this is having a child sit on the edge of my adjusting table. You can use a bed or something where they've got room to sort of fall back on. And I tell them to hold their arms up bent. I'm going to bring this down a little bit. I have them bring their arms in, and I have them just hold their hands here, because sometimes if I have them hold like this, they don't know what to do with their hands. So I have them bring their hands and elbows up here so that they're not clasping onto something. And then I tell them I'm going to push them back. And you will get, like, some kids are like, whoa, they get really quite frightened. Sometimes it's fun. You hope it's fun and not fearful, because that's what you're going to be doing if you want to try and help this reflex integrate. That's one of the ways you can do it. If I push them back and their arms go out, that is a positive reflex. It's also a really good core exercise, and sometimes I'll have them do this instead of having their legs over the edge of the bed or the table, is I'll have them sit cross-legged, because that uses even more of their core. So these are some ways. There's a couple of other ways I can do it too, but these are some of the most common that I use. Okay, so why is it important for the Moro to integrate and not become retained? Well, there is a huge aspect. Remember, when the Moro reflex gets activated, you have the sympathetic system getting activated, and you are having a release of stress hormones. So what this would mean is, in a child with a Moro that is retained, they're on high alert all the time. Like, what's going to happen? When is it going to happen? They can't relax. They're jumpy. They just can't settle in, because they are waiting for the next time this Moro is going to be activated. So this integration allows more of the parasympathetic, which is our rest and digest system, to come in and be more active, which will help decrease the stress hormones. So it's a balance of gas pedal and the brakes. The sympathetics are the gas pedal, the parasympathetics are the brakes. We need both, and we need them in balance. And if this Moro is not integrated, too much gas pedal, it's not going to be good. It's going to burn them out, and it will burn anybody out. And I think I'm going to put a link to my video I did about stress. I called it "Is Stress Killing You?" And it will talk all about the sympathetic and the parasympathetic system. So I highly recommend you have a look at that. The other thing it can do is help prevent allergies and sensitivities. So this is in relation to stress hormones, because if they're completely activated, they're going to break down the adrenal system, which can lead to allergies, frequent infections, low energy, conditions that are related to low immunity, like asthma, eczema, all those atopic disorders, frequent ear, nose, and throat infections. The other thing is that with this sympathetic dominance, it can also be possibly one of the reasons babies have colic. So typically colic is diagnosed between like 3 weeks and 3 months. Okay, well, if this is supposed to integrate by 4 months, then it could be, if a child has a hyper Moro response and they're waking themselves up because of this hyper Moro response, and then it doesn't integrate, maybe it's this aspect of colic with the nervous system where their just system is irritated and they can't rest and digest, and that's how it manifests. Now, this is just a proposition I have based on what I know of the nervous system. What about if this is why a child is considered hyperactive? They're hypervigilant, they can't stop moving, they basically have their foot on the gas pedal. So maybe this is a reason why a child is considered hyperactive. All of these things we have to consider. Not only that, but what about later in life? Okay, what about when does high blood pressure and heart disease begin? Stress hormones affect our blood pressure, heart rate, and our rate of respiration and breathing. What about diabetes? What if this is one of the first steps towards diabetes later on in life? Because some of these kids, because of the amount of stress hormones, might burn their blood sugar more readily. Or what if it's the digestive issues as adults that we have? What if it starts out at this stage? So these are all things to think about when we talk about Moro, the importance of this integration. Now, it's also going to allow with a child who's able to relax, they can feel what's going on in their own body. They can then relate to other people. They can relax enough to read a room and look at social cues. And they're also going to be able to settle in and focus and relax to learn in school. Again, if they're hyper vigilant and it's like, what's over there? What's that noise over there? What's that thing over there? I saw something move over there. And if they're constantly reading their environment because that's how they're wired, then they're not going to be able to focus on what the teacher's saying and what they're writing on the board or the project that they're supposed to be working on. Not only that, but it can lead to things like not, getting along with their peers and being aggressive and this type of thing. Now, this aspect of the vestibular system is also needed for proper development of balance, coordination, vision, and hearing. And so this is why it is so important for this Moro reflex to be integrated. So what does it look like if a child has a retained Moro reflex? What might be some things that you would see in your child if this reflex has not been integrated into more adult and mature postural reflexes? Well, we talked about this fight or flight aspect, the sympathetic system that puts them into a heightened state of awareness. And that could create things like anxiety, fear, phobias, muscle tension, aggression, or even withdrawal from others, emotional instability and sensitivity, hyperactivity, and dislikes, changes, or surprises. These are the kids that they want to know their routine. If you deviate it, they're not going to be happy about it. And they're the ones that will have the mood swings and possibly low self-esteem, and just that emotional instability, the up and down. You don't know where they're coming from. One minute they're happy, the next, no. Any little thing kind of throws them off, all right? The other thing that you might see are immune system issues, as I talked about with those stress hormones. They break down the gut-brain system, okay? There's a whole thing that goes along with stress hormones if they're not allowed to kind of calm themselves down, and that's what leads to some of the things that you see there, the atopic disorders, frequent infections, that type of thing. Vision problems, so eye movement, visual perception problems. They have difficulty ignoring irrelevant material in the visual field. So again, this goes back to the focus. They see things all over. I see something over there. There's something moving over there. What's that over there? And they can't just settle in and focus. They cannot ignore it. They have difficulty with black print on a white background. Well, what does that sound like? That's like every book. So they might have issues with reading. They might have light sensitivity because that is considered a threat to them. And they might even tire easily under fluorescent lights because those are super harsh for anybody, but especially kids with a retained Moro reflex. They can also have poor auditory discrimination. Same thing, they can't ignore background noises. It's like, what's that buzz over there? What's that going on outside? What's that noise? Every little thing, shuffling of papers. What's that? What's that I hear? They have to constantly scan their environment because they don't know when that threat is coming. They are going to have poor learning skills because of all these things. And then they're going to also be hypersensitive to any change in their environment. Light, sound, food, textures, contact with things. It just like the world is not a safe place. and they are going to be sensitive to it. That is what this reflex will do if it doesn't integrate. One of the remediation exercises I use is called the STARFISH. And in this, you are sort of reproducing what happens in the Moro Reflex, first with the extension phase, and then coming in with the flexion phase. So first starting off, we've got the right side on top on the arms and the legs, opening up slowly, extending the fingers into a starfish shape, and then coming back slowly so the left hand and the left arm and left leg are on top and kind of almost like a fetal position, bending forward a little bit, coming back out to the starfish, and then coming back to that beginning position right on top, and that is one complete round. This takes a lot of coordination. It takes a lot of effort for a child who is having issues with a retained Moro reflex, so you might need to help them do this. There's some other ways that I also do this, and it involves games similar to testing an older child sitting on the edge of the table, where I tell parents to just keep pushing them back over and over. And even sort of like faking it, like fake like you're going to do it and then actually do it. But do it in a way that they're not anticipating and leaning forward, because that's cheating, and that they're setting up back into action so that it can be done repetitively. And you can also practice the test where you have the child do the trust fall and drop back, so you can practice that if that's available to you. And there's other ways I do this for smaller baby, or they're older babies, but smaller children in the toddler range, where I have the child seated on mom or dad's lap, and you're trying to do the push as you catch them. It's a little bit more tricky. Toddlers are a little bit, takes a little bit of ingenuity. But there's other ways to do this where you're trying to recreate that perceived threat and activating the vestibular system and the other proprioceptive systems. That child feels like they're going to fall, and they're going to try and, if they're younger and you're holding them, they're going to try and hold on. So you can't do it if they're holding on, so you have to get the hands free. It can be tricky, I'm not going to lie. All right, we are at the end. I hope you enjoyed this presentation of the Moro Reflex. I hope it has increased your understanding of its importance, of why we need it, but then why we need to have it integrate, to have our brains grow in a way that is going to have optimal connectivity and optimal function, because that growth of the brainstem and all the things in the brainstem, including the primitive reflexes, if that is not available to the child and integrated, those bottom lungs of the ladder are going to be incomplete. The child will do workarounds, but those workarounds are never as efficient as going back and having us fill in those rungs. All right. I have all my information here if you'd like to contact me. I'm able to work remotely and in office for many of these things, including working with the primitive reflexes. So I hope you found this helpful. I will be continuing next week with the primitive reflexes. So stay tuned for that. And I am also creating a playlist so you can go back and play the whole series. All right, everybody, remember, thumbs up, like, share, subscribe, get notifications, all that good stuff so that you don't miss any of my videos when I come on. I will see you next week, 7 p.m. Tuesday nights. 6:30 p.m. Tuesday nights Pacific time for the next video. Have a great week. Bye.